Hello, this is Dr. Do again. This video is continuously from the systemic approach of medicine, streaming from previous video. Basically, this stream of video starts with invisible structures such as major organic compounds and associated diseases, and also moving on to the cellular level and also the tissue level and also to the organ system levels. So this is just a kind of rehearse what is happening while I had this video, and because I had a previous streaming of videos. So this is today I'm going to continue with the respiratory disease, respiratory system associated diseases. Actually, today I'm going to bring up the very common clinical scenario that is chest pain, but I'm going to focus on what are the causes and the major causes of the chest pain from the respiratory system. So what kind of respiratory system condition can cause the chest pain? So that is the focus of this video. So chest pain basically could be the inside from internal organ, could be caused by the chest wall from outside, or the internal organ. Could be the heart, could be the lung, or could be just the outside musculoskeletal system. So this is, but today I'm going to talk about the chest pain associated with the respiratory system. So some of the diseases I mentioned here, the chest pain is the mandatory condition in order to diagnose that disease. Some of them may or may not have chest pain, but so this is about the chest pain associated with respiratory conditions, respiratory systems. So what are the causes? First of all, let me just list it, the causes I can think. First one, pneumonia may or may not have chest pain, and pulmonary embolism may or may not have chest pain. Pleuritis, I think, has had chest pain all the time, definitely, unless there's flu. I think there's no unless. Pleuritis, the presentation, the symptom is chest pain. Depends on the causes, fever, chest pain, or even though there are sometimes pleuritis without fever caused by the systemic inflammatory disease, but the chest pain, I think it's the symptom of the presentation. So this is, and then I'm going to break down individually about the chest pain associated symptoms to tell you what they are, whether it is a pleuritis or whether it is pneumonia, or whether it is a pulmonary embolism. So let me just talk about the pleuritis first, because in breaking down to the age groups, pleuritis could occur in young or older people, not necessarily in older people. Sometimes young people may also have this pleuritis as part of systemic conditions or part of the respiratory tract infections or part of systemic inflammatory diseases. So the symptoms of this pleuritis depends on the causes. Fever, usually indicating it's the bacterial infection, different kind of variety of bacteria, and usually it may just come from the lung or from the systemic hematogeneously. So that's another possible of the pleuritis. And also pleuritis can be lupus, for example, systemic conditions, inflammation or autoimmune caused conditions, and then cause this pleuritis. So basically, this is the one of the signs: fever and chest pain. The unique part of the chest pain caused by the pleuritis, I think I mentioned previously in the other stream of video, is it's a position or breathing associate. When you breathe in or when you breathe out, the stretching the pleural causes this pain. Actually, the pleuritis, the pain from pleuritis could be worse than the pneumonia or the lung cause the pain, because the pleural are the serous membrane structure wrapping on top of the lung, and also there's a space with some lubricant solution, and there's another layer on the chest wall. So this inflammation of this pleural will really irritate, reach nerve endings on the pleura. So that's why the pleuritis could be very painful. It's a sharp pain associated with breathing. So this is about the another important symptoms, whether it is pneumonia or pleuritis. This is a difference. And also the late stage or the early stage of pleuritis may have effusions, fluid in between the two layers, and a later stage, this effusion becomes absorbed and left some fibrotic tissue, and then the physician will hear the rubbery sound. It's like the friction sound during the breathing, because the rubbing of these two layers of pleural cause that. So this is about the pleuritis. In terms of treatment, of course, you need to see the physician to diagnose it. So regardless, anyway, without whether you're young or old, if you have this positional or positional chest pain or chest pain associated with breathing, then go see your physician, particularly for those who have systemic diseases, chronic kidney disease, chronic liver disease, or autoimmune conditions. If you have the symptoms, go see your physician, and they will probably do the test to imaging or draw the fluid to test whether what are the causes for this pleuritis. And the other causes of this chest pain may or may not is pulmonary embolism. I think I mentioned before. Pulmonary embolism depends on the location. If it is peripheral, near the pleural, actually the pain is really from those serous membrane structures, reach of nerve endings. If it is the center of the lung, usually the pain is not presented. Usually when it is reaching the peripheral area, irritate the pleural, that is the pain. That's where you feel the pain. So, and the pulmonary embolism, I have already mentioned the risk factors for either systemic conditions and previous DVT, deep venous thrombosis, or long-term bedriding without activity and a sedative life, and also young female with the contraceptive pills. These are all those who had family conditions of coagulation, hypercoagulated states, develop DVT, and then have this pulmonary embolism. So this is about, and also the symptoms, heart rate increase very fast, and may or may not have chest pain, may or may not have low-grade fever. So this is about the pulmonary embolism. And in terms of diagnosis, if you have the risk factors, if you develop the symptoms, then talk to your physician to get checked. And the other respiratory conditions associated with chest pain is pneumonia. The same idea. The visceral, the organs itself, really the pain is not that severe unless it irritates the serous membranes, the structure which had really the reach of nerve endings, just like meninges versus brain. The encephalitis or versus the meningitis, the pain is different. But I'm going to spend some time next time talk about this visceral pain and also the serous cause of pain. Anyway, so this pneumonia, if it is also a lobar pneumonia, for example, really solidify of the lobe and irritate the membranous structure, or irritate the septum between the lobes, that's where the pain comes from. Of course, pneumonia can occur with young people, older people, with coughing, fever, either caused by bacteria or viral. But this is, in general, I think I just talked about the previous video. So this video is about the chest pain caused by the respiratory conditions. Of course, the chest pain can be caused by the heart or cardiovascular diseases. I'm going to talk about that when I talk about the cardiovascular systems. So I'm going to stop here today, and thank you for watching. I'll see you next time.